morning, gang. Dr. Sean Hubbard here. Thank you so much for joining me in the Winner's Circle. We're continuing our conversation on improving your health. And when I say improving your health, really what I'm referring to specifically is health promotion. Now, I've been talking about wellness and health promotion for more than 10 years now, and sometimes I notice that my friends with whom I've been talking throughout this period hear me as describing prevention. And so I figured that I should probably do a better job of explaining and differentiating what health promotion means to me. I think that if we think about health promotion in certain terms, that it can be the difference between not doing very well and doing very well. Let's see what we can learn today and this week.
Let's face it, you're human, things happen. You break something, an artery blocks, you have severe pain, you can't breathe. The best place to be is in a hospital. We can stabilize your breathing, you can be on intravenous medications, you can have surgery. There's no place that does this better than in the hospital.
It's not every day that I'm asked to see somebody who's 25 years old in the hospital, but usually when I am, there's drugs involved.
Okay, so we got more background information. Nicholas, as it turns out, has a history of depression and previous suicide attempts. The night before he came into the hospital, he had what was described as a massive argument with his mother. They found him the next morning, but he was brought into the emergency department and a CAT scan was performed and has this large area here looking like a stroke. Once the breathing tube was taken out, he was asked to undergo an MRI of the brain. You can see here that there's a large white area on the left side, which corresponds to the abnormality that we saw on the CAT scan. Given what we discovered as a new stroke, Nicholas underwent an echocardiogram and heart ultrasound, which showed an atrial septal defect. It seems as though he'll either require heart surgery or blood-thinning medications.
I've been practicing long enough that there are more patients my age than there used to be. Now we're going to see somebody who was 46 years old and has been complaining of new weakness on one side. Let's check it out.
Okay, so we got more information. Robert started having symptoms on Sunday of left side weakness, but he didn't come right into the emergency department. He thought that if he rested, the symptoms would get better. He came in on Tuesday and he underwent this CAT scan of the brain to evaluate for new blood. We didn't find any, so we asked him to undergo an MRI of the brain. The MRI, you can see here on the right side, does show white spots consistent with a new stroke. If he had come in earlier, we would have been able to treat him with TPA. That's right, just like we said before, if you can't breathe, you have sudden and severe pain, you have new weakness, you might need some new medications or some surgery. Sounds like you need to be in the hospital. And usually, when you're in the hospital, we evaluate all of your risk factors for developing critical disease. We then recommend medications and some non-medication approaches to decreasing your risk factors, also known as prevention. Prevention can include anything from wearing a seatbelt or helmet to taking medications to manage your blood pressure, your blood glucose level, or your fluid balance for patients who are prone to congestion. But with health promotion, the focus is entirely different. It's on health and function and performance. People who are into health promotion are seeking to maintain and even improve and function over time. They seek to enhance not only the body, but also the mind and the soul, inspiring a healthiness of living that lasts through the generations. Thanks again for joining us for this weekly program. If health promotion sounds interesting to you and you'd like to hear more specifics about how to get started, like and subscribe to our channel, and we'll look forward to joining you next week when we talk more specifics. We hope that you'll enjoy a wonderful weekend and keep winning.